So I'm Farooq Ahmed. I'm a consultant and specialist orthodontist. I have the pleasure to work here in northwest London in private practice. I also teach part-time in hospital at Guy's Hospital. I've been qualified now as a specialist since 2015, so going on 9 years. And I'm really passionate about orthodontics. It dominates my life, both in a professional sense, but also I have a podcast, so I do my own social media when it comes to teaching in orthodontics, I'm sad as it is to say. And it's really something which I enjoy sharing both with my patients and the outcomes, with my colleagues who are learning, but also general dentists who are out there, so they can learn about this field, about this speciality, and benefit their patients. I think I'm very privileged to have the job that I do. IPR means interproximal reduction. It's simply the slenderization of teeth to create space for orthodontic purposes. Now, its function has become more popular due to the use of aligners, but also it's inherent as part of fixed appliances in contemporary practice. When should you carry out IPR? It's a question which is not a simple one to answer. It's about planning and staging. The same as when it comes to preparing a full mouth rehabilitation case. Where do you start? The planning of IPR has been missed out, I feel, within orthodontics, both for aligners and fixed appliances. So the premise of having a protocol, which is what I educate on, allows dentists to have that first point of knowing how much quantity of IPR is appropriate, and then working towards the tools that you have in your own clinical practice at this point to deliver reliable and safe IPR. I think the challenge that we have is IPR is just overlooked. Deliver the IPR, focus on moving the teeth. You can't do one without the other. And that's really why I like teaching this topic. The answer is no, inherently not. Is every patient safe to have a crown placed? No, it really depends upon the patient's caries risk, the anatomy of the patient's teeth, the quantity of movement that's required. I think the saddest things that we have is when we deliver IPR and we have spaces left over at the end. That's an irreversible process. There's no enamel coming back, and we haven't followed a protocol. We've just done what we're requested to do without consideration. And really for me, that's the worst case scenario in IPR, to have spaces left. Usually it's aligner companies. So they come up with a AI-driven or algorithm-driven plan, and they work out how much the teeth overlap, and then say, do this amount of IPR there. The challenge with that process is there's errors throughout the process, whether it comes to taking a scan, which isn't 100% accurate. When it comes to them digitally manipulating the teeth, they systematically undersize the teeth. There's an error within the whole process. So when they request 0.5, it's a quantitative amount. If you deliver that in a system which has these errors, you can over-deliver. So IPR, doing in one stage, in one visit, it's like having to say, okay, well, who should I invest my stocks and shares in this year? And only choosing one particular outfit to invest in. It's not intelligent. You should spread it. So planning it at the beginning, reassessing it in the middle, and delivering anything residual at the end that you need is the way to maximize IPR in a safe, reliable, and anatomical way. So it's not a one-stage process. It's not a one-size-fits-all. There's no one item to deliver IPR that's perfect. You've got to go between tools depending on what you need. And that fluidity is really what I want to try and get across. It's not a one point in your aligner case or your fixed appliance case. It's a reassessment through the process. Just like reassessing patients' periodontal health. You don't fix it at the beginning just by doing a sublingual scale. You monitor it and assess it and retreat the patient as is needed. The concept of IPR, reducing the enamel, inherently points us towards, well, there must be less protection for the patient's dentine, there could be sensitivity that takes place, increased caries processes because there's less enamel. Fundamentally, we have to understand, mechanical removal of enamel is different to demineralization. This is not the same as a caries-driven process resulting in loss of enamel. Now, the research is quite varied on this topic and unfortunately not the most detailed. What we understand is that when you remove the enamel mechanically, the surface that's left is likely to remineralize to the degree it's resistant. 10-year long-term follow-up studies, a systematic review no less, shows no increase in caries taking place. Periodontal health is also not compromised and no increase in sensitivity. The point, though, to conclude that sentence, because it's incomplete, is patients have to have a low caries risk. The IPR has to follow a protocol, because that's what the research is based on. Without having stages in the process of planning, delivering anatomical IPR and polishing, that research doesn't apply. I think that's where we miss out on IPR. Without a protocol, we can create these problems, but we can avoid them through that process of a protocol. This year's Dentistry Show London, I'll be discussing interproximal reduction or IPR. Now, we will focus on both the clinical side, which has different methods that are available, we'll discuss them in detail, but the second stage, which gets missed out, which is the planning of IPR. Specifically, we'll be looking at staging of IPR and when to defer IPR. It's not in isolation. IPR is one mechanism to deliver space. We'll talk to you how to deliver it safely, how to follow my protocols so you can be reliable in delivering it. But it is part of orthodontics at large. And I'll go through how to use the space once it's created, which sometimes we forget about after we create our space. So please join me this year at the Dentistry Show London, which will be on the 4th and 5th of October, where I'll go through my lecture on interproximal reduction and share with you guys my pearls of wisdom over the years of teaching, education and clinical practice within orthodontics. So to find out more about interproximal reduction, I teach this course as a passion because I've struggled with it myself clinically. So I have my course, which happens twice a year. You can follow that on Instagram and Facebook at Farooq Orthodontist. You can send me messages. I'm happy to advise and give people content that I can share with you. And join me at the Dentistry Show London, where you can find out more about this topic so you can plan things safely and also follow the evidence-based protocols, which I'll be sharing with you.